and welcome to the latest episode of Face to Face with BioVoice News. The integration of artificial intelligence and digital tools have ushered in a new era of innovation and progress in healthcare. With each passing day, these technologies are reshaping the landscape of patient care, diagnosis, and treatment. To get the latest trends around this space, today we have with us Dr. Jag Singh, Professor of Medicine at Harvard Medical School, Boston, and Principal Advisor of SmartCardia. A warm welcome to you, Dr. Singh, and a pleasure to connect, sir.
Thank you for having me, Rahul. I'm excited to be here.
My first question to you would be, how do you look at the current state of healthcare in India, and where do we stand in terms of implementation of digital technologies in healthcare delivery?
That's a great question, Rahul. I think India, just like every other country, has some disparities in care. So the extent of wearable technology and the use of AI within, I would say, the private sector is quite different from what it is in the public sector, quite different in urban areas compared to what it is in rural areas. So I think there's disparity in the ability to actually implement care at this point in time. However, having said that, almost 85% of patients and adults in India have smartphones. So the opportunity of using mobile health as well as telehealth exists widely, rampantly across the country. It's just not being implemented as effectively at this point in time. And I think a part of that is the awareness aspect of things. But I think India is uniquely poised. I think it's uniquely poised to actually disrupt the conventional way we treat patients. And I think that's through low-cost strategies, low-cost medtech strategies that can help us not only educate patients, but also screen patients, diagnose diseases, and potentially in the future also help implement healthcare delivery. So I think there's a lot of room for progress. There's a small proportion of patients that already use wearables in monitoring their physical activity and diabetes. But I think there's a lot of room for growth out here for sure.
So are there any examples of AI applications in healthcare, and how do they benefit patients and healthcare providers?
Absolutely. So when I look at the future of care, Rahul, I look at it as something that's going to be potentially virtual, something that's going to be sensor aided, and it's going to be powered by predictive analytics and AI in sustainable workflows that allows us to look after patients in a more personalized way. Now, for all this to happen, obviously there are many components to it, but AI already exists in many ways. And I think AI, for the convenience of our listeners, is important for us to kind of substratify it into something called conventional AI that looks at patterns and predicts and risk stratifies patients. And the other one is generative AI, which is ChatGPT and the other large language models. Now, conventional AI is already being used by radiologists to help diagnose patients with cancer before the cancer actually occurs. It is able to risk stratify patients who are potentially going to develop cancer in the future. Beyond that, also, AI is also being used in, looking at retinal photographs and actually diagnosing patients with coronary artery disease, diagnosing patients with the risk for sudden cardiac death, as well as diagnosing patients who might have chronic kidney disease. So there are already some palpable forms of AI, even in managing patients with heart failure. I, as a cardiologist, we're already beginning to consider using AI to look at an ECG and predict what the heart function of a patient is, and predict whether a patient is at more risk for a stroke or more risk for sudden cardiac death. So it's already finding its way into clinical practice as conventional AI. And I think generative AI is a whole different ballgame. I think ChatGPT and other large language models will really change the way we practice medicine. Some of it is already happening in our hospital at Mass General Hospital. We're already using generative AI to help risk profile certain subsets of patients with heart failure. But beyond that, also using generative AI to help physicians look after patients in a more seamless fashion. And that seamless fashion is when you're talking to a patient, the notes are automatically generated by AI-based strategies so that they're then fed directly into the electronic medical records that you can edit, making it less burdensome for clinicians. And we're also using AI chatbots now to respond to patients' questions because that's much faster and oftentimes more empathetic than conventional clinicians.
Sir, if I'm correct, your keynote speech in Mumbai was all about AI applications in cardiology. Would you like to throw some light on that aspect as well, for the benefit of the audience?
Oh, absolutely. So cardiology, there are many aspects. I think there are lots of sensors now that are available. There are patch monitor sensors that we can actually now, through patch monitors, monitor the ECG. And there, in the new patch monitors, there are also other sensors like physical activity and other, fluid levels in the heart that can be monitored now. So I think these sensor strategies in cardiology specifically allow us to better monitor patients who have heart rhythm disturbances, who are at risk for developing heart rhythm disturbances, but also monitoring patients with heart failure. So in my keynote address, I really use the example of heart failure and how we can actually change the paradigm of treating patients with heart failure and preventing readmissions with heart failure, because that's one of the most expensive things, not just in the US, but even in India. There's an epidemic of heart failure. And I think we need to find a mechanism of helping patients look after themselves, but at the same time, preventing patients from having readmissions and suffering and having to go to the hospital. And some of the work through sensors and wearables will allow us to actually do this in a more effective manner.
So how long will it take to scale it up from the pilot mode, especially in Indian context? I mean, there's a huge population, and as you said, there's a rise of cases and of stroke and particularly heart attacks. So how long will it take to see this on the ground?
For sure. So I think that's a great question, Rahul. I think the scaling depends on the type of clinical strategy you are using, right? If you have something that's very low cost, right? For example, an app that has really minimal cost that can help you diagnose patients with, let's say, atrial fibrillation, or even diagnose patients with tuberculosis. If there are apps that are low cost, the scaling up and the dissemination becomes a lot much easier. It's when the app or the sensor-based strategy is more expensive, then scaling becomes a little issue. But I think India is uniquely poised to really create low-cost solutions out here. And I think the deeper part of the question that you asked, Rahul, I think is that we really need to enhance awareness. And after the awareness, we need to really enhance the acceptability by patients. And beyond the acceptability, then we need to ensure that it's accessible. We have to enhance digital literacy. We have to enhance accessibility of the technology to patients so that we can scale it to a level that it actually has and makes a difference at the population level.
I was coming to that part also, especially the challenging, what are the challenges that exist in implementing such tools, and how can we address those challenges?
No, so the challenges are obviously an issue. And I think when I look at challenges, I try to categorize the challenges at the patient level, at the physician level, but also I try to look at what the challenges are at the healthcare organization and the hospital level, right? At the patient level is exactly what we just talked, is awareness, accessibility, and acceptability, I think, are challenges. At the physician level, I think the challenges are more in physicians trusting the AI, making sure they understand why the AI is saying something, whether it's correlating with their own clinical suspicion. That's one. The second thing is the AI explainable? Can they understand why it's doing what it's doing, and what's the trust element out there? And I think one of the biggest challenges within clinicians is the status quo. I mean, we train in a certain way, and then when we train in a certain way, we don't like to deviate from the way we've learned medicine. So for challenging the status quo becomes a bit of a problem, and I think that's a barrier at the physician level or the clinician level. And at the healthcare organization level, which is probably what you're asking, I think there are two things: resources, adjusting the priorities appropriately, and then making sure that this is a fiscally viable, sustainable approach. Because most healthcare organizations and hospitals are looking at trying to make their ends meet and making sure that the return on investments is quick. They're not looking 5 and 10 years ahead. And that's where I think we need to really kind of reconfigure the conversation. And that's why these conversations are so important, Rahul, that the political will and the leadership within organizations need to recognize that medicine is moving in this way. And we have to adapt and get along with it, because otherwise we're going to fall behind.
Right, right. And there's another challenge, that is patient privacy and data security. So how do we ensure that these are also taken care of while implementing these digital tools?
That's a very good question. I think that is at the top of everyone's mind is, is my data not my own data anymore? And what are people going to do with the data? So I think data privacy is really important. And some of the ways we deal with this is we ensure that as we generate our data sets, one, they're very generalizable, but more importantly, we make sure that they're de-identified. That means you cannot relate the data to a patient, and you can't go backwards and say this data came from this patient. So we use de-identified data sets. There are also different ways of now different organizations, as they collaborate around AI, share the data. First, they were sharing their data sets. Now they say, you know what, we're not going to share our data sets because we want to keep the privacy within our institutions, but we'll share the algorithm. And that's called a federated way of sharing data, where you don't share the data sets, you share the algorithm, and every organization then tweaks the algorithm. And that way the privacy of the patients is kept within the institution that they were actually seen by. And then I think it's very important, and I think you alluded to this, we have to make sure that the guardrails are put in place, and the regulatory bodies are doing their job to make sure that patients are being able to consent for their data being used for AI, and at the same time withdraw their consent whenever they feel that they don't want their data to be used for AI. And I think it's important to use AI responsibly, not just for collecting the data, but even for annotating, curating, and aggregating the data. I think we have to keep privacy at the forefront of our minds.
So how is the regulatory scenario around these technologies, in globally as well as in India?
Can you repeat that again? I think my internet may have cracked up a little bit.
So, how is the regulatory scenario around these technologies globally as well as in India? Particularly the digital
absolutely.
technologies. Yeah.
Absolutely. So regulatory bodies are working very hard to stay ahead of the rapidly evolving changes in AI. We already have those concerns with generative AI moving so quickly that the regulatory bodies are having difficulties keeping pace. I think the main thing to do are three things. One is transparency. Second thing is traceability. And the third thing is generalizability. So I think it's so important that the data sets that we use with the algorithms, let's say an algorithm is developed in the US, that may not be applicable in India because the data sets that they were developed from are not representing people that live in India, because the ethnic variation can really affect the algorithm. So I think it's really important, one, to know the components of a data set that generated the algorithm. Second, to know if the patients where the algorithm is being tested are truly represented in the data set. And then obviously also ensuring that there's transparency and traceability. And I think the FDA, along with many European bodies, are trying to do exactly that. But the field is moving faster than they are at this point in time. But nevertheless, there are a lot of efforts being made to make sure that these guardrails are put in place.
Right, sir. And what could be the possible role of AI technology and other digital tools in preventive healthcare and personalized medicine, especially?
For sure, for sure. So I think that's the holy grail. So when you look at patients, you try to break patients into in how they get care. There's an upstream care that patients who receive complicated and surgical services. There's midstream care where patients have chronic diseases, and there's mainstream care where patients you concentrate on their wellness. For a patient to become unwell leads to a chronic disease, and the chronic disease lands up in patients getting care. And we have to work to personalize medicine, as a result of which you enhance the wellness so they don't develop chronic diseases and don't need upstream costly specialty care. So many sensor-based approaches are actually now facilitating patients to get a better sense of their healthcare situation, better monitor their health disease, better stratify them, and actually track their different diseases that they may have. For example, diabetes. We have now sensors that can track patients with diabetes. They're being widely used in India too, but it allows patients now to engage in their own wellness by looking at their own data and monitoring their disease state. So I think if we talk about the future, I think manage your own disease is going to be a mantra of the future care, where patients are actually going to be engaged in their own care using sensors and wearables, assisted by some AI algorithms that are personalized for their care with continuous surveillance that allows them to actually live healthier lives and potentially, keep their diabetes or hypertension or coronary disease all under well control.
So you have shared some glimpse. I would like to go deeper, into the current trends. Where exactly do we stand in terms of technology development, and what could we, you could envision the kind of future which is there. After 5 years, what will these technologies look like?
So I think in 5 years to 10 years, you're going to have multiple sensors. These multiple sensors will potentially be interconnected by the Internet of Things, that they will talk to each other. You will have multidisciplinary virtual care strategies where many physicians from different specialties will see the patient at the same time virtually. There will be sensor-aided guidance of that care through multiple sensors, providing various inputs from the different organ systems, because we know, and I didn't mention this, Rahul, but every organ system in the human body will potentially be digitized. And when that is digitized, you will have digital dashboards that will allow us to understand which organ needs, servicing, like the check engine light in a automobile. So I think the future will have multiple sensors with multidisciplinary care. And I think the biggest thing that I think, which is very close to my heart, is that it will ensure health equity, because it'll be scalable, like we talked about, and it'll allow us to actually look after patients anywhere in the world. And the last thing I think, which I've not said about how things will progress, I think the role of generative AI will become a big thing in medicine. But beyond that, I think robotics and the role of virtual reality and the metaverse will also be a big part of the way we actually deliver care in the future.
So there will be a lot of companies who will be working in this area, and in fact, their numbers will increase with each passing year. So are there any ethical considerations which they should take into account when they are developing these particular technologies?
So I think the ethical issues are really manifold. I think the most important thing with ethical issues are, as we already talked about, data privacy and security. You have to ensure. The other things I think that are important is ensuring that the patients have the opportunity to give informed consent if their data is being used for artificial intelligence purposes. I think the other things is to ensure that there's no bias, that the data sets that are being used are free of bias and are generalizable across the population. The fifth thing I would say is accountability. It's so important that the algorithm that is being generated and being implemented as a part of this whole process needs to be accountable. And the companies that help create the algorithms really have to have some accountability and some skin in the game out here. I think the other ethical issues, which we talked about before, is really access. It is so important that we ensure that everybody has access to this, and it's not just the elite few, or we further the digital divide by only the ones who can actually afford the care. But we have to make sure it's scalable, we have to make sure it's accessible, and we have to make sure that it provides the opportunity for health equity.
And so how affordable will it be? We have talked about accessibility. We have talked about other, dimensions also, but particularly the affordability part we haven't discussed. How affordable these will be in the longer run?
So absolutely. So I think there will be some upfront costs, but I think as technology becomes more robust and more available, the costs always decrease. I think the role that India has that it can really play out here is to make this technology affordable through low cost situations. There are some simple technology, there are simple apps that are being used now that can monitor the cough of a patient into your phone, and using AI-based approaches actually determine if the patients are more vulnerable for active tuberculosis or not. So a simple app can help diagnose tuberculosis. There are apps that can diagnose anemia in pregnant women by just looking at their eyes with the PPG signal. There are PPG signal apps, that is photoplethysmography apps off the phone, that can diagnose a variety of conditions, right from atrial fibrillation and the like. So I think those apps that are in our handheld phone that don't require external sensor-aided approaches will be the first to be able to be scaled widely. And I do think the costs will be fairly well controlled. They have to be. They have to be controlled, especially in India, if you expect this to be scalable.
Right. And sir, would you like to talk in brief about your book, Future Care, Sensors, Artificial Intelligence, and the Reinvention of Medicine? What is the book all about, and some key aspects related to the book?
Great, thank you for that, Rahul. So the book is a simple book. I think it's for anybody who's interested in their healthcare. It's not necessarily for physicians. I have a lot of patients who actually read this. The book really outlines what we talked about, of how the future of care will be sensor-aided, will be virtual, will be powered by predictive analytics, and will have sustainable workflows that will translate into clinical outcomes. The most important part of the book is that it's got a lot of patient stories of how care exists right now and how care could exist in the future. And I really talk about tangible technology. I don't talk about dystopian technology. I talk about something that's just around the corner that we need to start understanding very quickly if we want to become a part of this whole healthcare revolution, and at the same time facilitate it in terms of actually enhancing care, not just in your own area, but across the world.
In India, you must be seeing in last 4 to 5 years, government is also putting a lot of onus on digital healthcare. There have been a lot of policies which have come into picture. So Niti Aayog is also implementing some initiatives. So how do you see this at the policy level, and what needs to be done more to make it more, to scale it up?
I think India is doing exactly the right things, and that's why I say they're uniquely poised to disrupt the space. I think what India has to do probably a little better, because I gave a book tour right now at All India Institute of Medical Sciences, as well as in Chandigarh, as well as in 3 hospitals in Mumbai, that the awareness is still fairly lacking. So I think despite these efforts, we really have to enhance the way we deliver education and enhance awareness across the country uniformly. That's one. And I think with that, we also have to educate. I think one of the lowest cost strategies for preventing disease is education, is educating patients about their disease and putting into play preventative strategies, which actually is a form of personalized medicine. The possibility of making a difference right now with all these initiatives in India is fantastic.
Right. So thank you so much, Dr. Singh, for your time and valuable insights. It was really nice to interact. Thank you, sir.
Thank you, Rahul. Appreciate it. All the best. Bye-bye.
Thank you.
Yeah.
Dear audience, hope you liked this discussion. If you found this very informative, don't forget to like the video and hit the subscriber button. We shall be soon back with another episode of Face to Face. Stay tuned. Thank you and goodbye.